Who are the seniors in today's society? Exactly how old is a senior? If a senior, for example, has a mobility issue, does that person also have a disability? This Melanie Minute begins to consider some of these questions by sharing a few reflections on our own experiences with our parents or other older family members. We'll explore more in future episodes, but remember that June is Seniors Month in Canada and Ontario. And seniors' issues really are everyone's issues. But first, a brief message about Canadahelps.org.
Every dollar raised on Canadahelps.org on our Connect for Life page will give us the opportunity to be entered into a random draw for a grant of $10,000, ensuring our skills development training hubs become a reality. Help us out. As we get older, our parents are aging as well. And today I wanted to chat a little bit about some experiences my family has been going through as my parents are aging. A couple of years ago, my mom was living about 2 hours away from where I was, and she was living independently until my sister and her husband moved in with her for a while, and they really did everything for my mom. They cooked, they cleaned, they made sure the house was taken care of, and it was a big space, so it made sense that my mom would need some assistance. Well, my mom got ill, and she had been in the hospital, and really she was not healthy. And when she went home, she was not the same. She needed to now depend on a walker. She needed to have a little bit more monitoring of her blood pressure. She was on more medication. And we noticed that she was getting very isolated. She wasn't driving anymore, and she was just lonely and depressed. And this really started to notice that she stopped eating, and all of these things started to happen. This was the first time that we needed to navigate the care of our parents. And so my sisters, I have 3 younger sisters, and they're all amazing. But we had to sit down and talk to my mom about what this looked like. What did she want? Because again, it's all about choice and ensuring that everybody has a say in their own care plan. And my mom said, I'm fine. I'm going to stay in my house. But we noticed that she was forgetting to eat and drink. She was forgetting to do simple things like feed the dogs and things that she would normally do. Now, my mom used to be very active in the garden, going places, and she was just go, go, go. And so this was a very different turn of events. And we were concerned. This was something new to us. And we were speaking with our doctor, and she said, no, this is it's normal. Things are changing in mom's life, and we need to be prepared. So we talked about, okay, mom, so what happens when you can't stay at home? Maybe we need to get some care to come in because, again, my sister and her husband were working, and we had to make sure that my mom had what she needed. So this is when we started to find out about PSWs and what other care was available in the house to help with showering and preparing light meals, some light housekeeping, et cetera, et cetera. Just someone to be there when mom was home and my sister and her husband were not. We got her it was a necklace that had the button. So in case she had any issues, emergency, she fell, that somebody would be notified. And that actually, I always remember seeing those commercials, oh, help, I've fallen and I can't get up. And I thought, what a terrible thing to say. But after this experience with my mom, I think this is the biggest blessing there is because really, truly, it gives a sense of safety to the family and to the individual. Now, I'll be honest, my mom was not the best patient. She was a little bit difficult. She's stubborn. She wanted her independence. She didn't want to depend on anybody. But we worked through it. And it got to the point, unfortunately, my mom couldn't stay in the house anymore. And my sister and her husband were planning on moving. So we needed to think about what came next. So we explored, and my mom's doctors were actually in the city that I'm in. And so it was a very big way to get my mom down for good health care, to get to the doctors, and really to have the services that she so desperately needed. So after a lot of research, my sisters and I explored some retirement homes. And of course, we know that this is not an easy process for anybody who has been independent all their lives to have to now not only downsize and consider the next stage of life, but to actually admit that they need care and support. We did this and moved my mom into a retirement home. And honestly, she was so against it. I'm not going to like it. I hate it. It's going to be terrible. But I refer to it as the cruise ship on land. They have activities. They cook for you. My mom has her own little apartment, and it's actually quite nice. And she's met a lot of great friends. She's social. She's active. She goes out on outings. She does so many different things. And she's thriving. And I think that if she had stayed at home as much as she wanted to, even with the support, she wouldn't be thriving the way she is now. Now, I'll be honest though, and this is the focus of today's conversation, is about the winters. We know that people get sick. We know that people catch colds and flus and different respiratory issues. My mom has a lung condition. And whenever my mom gets a little bit of something, it turns into pneumonia. And it's actually very threatening for my mom. And last winter, it was her first winter in the retirement home, and there were lockdowns. There was a lot of outbreaks of different, whether it was COVID or RVS or any respiratory infections. So what happens in a retirement facility or a long-term care facility is if there's an outbreak, and that is determined by public health, if so many people have something, they will shut down the dining room, the activities, and people need to be isolated in their apartments. This isn't fun because it can be lonely and isolating, but also because the seniors are now used to a routine, going down for coffee and tea, going to those activities to play cards or bingo or trivia or any videos or movies or book club. All that thing is now stopped. And this year has not been so bad with the outbreaks, but we've just had an outbreak in my mom's retirement home. And my mom said this to me: I don't like it here. I don't like being told to stay in my room. And I'm giggling because I understand she's an adult. She doesn't want to be treated like a child. But my mom is also just overcoming about a pneumonia. And so I had to have a conversation with my mom. Mom, I understand. Completely hear what you're saying. But you know how terrible it was for you with pneumonia. And we have to now look at everybody else's health and well-being. You don't want the staff and your friends to get sick either. She's like, well, how come people go out and about without masks and they're sick? And I said, well, I can't answer that for you. And of course, with any outbreak, nobody from the outside world can come in to visit. So I said, it's okay, Mom, we can go on the computer and you can see us, your grandkids, you can talk on the phone. There's alternatives. But why I wanted to bring this up is that we have to realize that in our everyday life, when we get the sniffles in the winter or the change of temperature, and we're not feeling so great, we kind of cope with it, don't we? We just, okay, take some medication, maybe rest a bit, drink some fluids, and we're okay. But when we get older and our immune systems aren't as strong and we're living in a place where there's multiple people with different health concerns and challenges, we have to be more aware of the importance of wearing a mask or staying healthy and really isolating ourselves if we're not feeling well. This is just what I'm referring to in a retirement setting for seniors. But when you think about it, in everyday life, in the workplace, at school for kids, why would we go to work if we're sick? Why would we send our kids to school if they're sick? Because it's just going to spread the germs to all the people that work with them. So I would consider, as our seasons are changing and as we are still getting those colds and flus, if you notice somebody in your family is not feeling so good or you're not feeling okay yourself, don't go out into the community. Don't spread the love or the germs. Be cautious and be conscious of those around you and those that may be impacted, because you don't know what health concerns others have. Food for thought, whether you're in a retirement home, you're in a workplace, or you have kids that are going to school, consider those around us, because before you know it, summer will be here and we won't be talking about colds, hopefully. Until next time.
You have been listening to Connect for Life, the podcast. Connect for Life is a Canadian-based registered charity committed to eliminating barriers for people with disabilities. Visit connect4life.ca and join us in helping people with disabilities become the champions of their growth stories.